23 and I'm a student nurse. Is that okay if I follow you around today?
Sure can. I'm Jackie.
Okay, can you give me the SWOT report on the patient?
Yes. So we have with us Marta Yarn. She is 80 years young. She has no allergies. She is a full code and she is residing in room 529. She's currently a regular diet, but she's going to be NPO after midnight as she's scheduled for surgery in the morning. She was admitted due to a non-healing sacral ulcer, stage 3. They've tried treating it for about going on 3 months now with just it's been unsuccessful. Her current pain level is 6 out of 10, so I'm going to be reassessing that in just a bit. Her vitals are 144 over 90, pulse was 88, respiratory rate 24, and O2 sat was 92, so it's a little bit low. She currently has full range of motion, but she does use a walker, so be mindful of that when she is ambulating. She has Perla, and she is communicating well. As far as respiratory goes, her lung sounds were diminished in both bases. Her heart sounds were normal with S1, S2. She does have a cap refill of less than 3 with no reciting edema. When I assessed her abdominal region, it was soft and non-tender, and I did detect active bowel sounds in all 4 quadrants, so I was pleased with that. And she's currently voiding on her own, and however, she does report stress incontinence with natriuria.
So why this client receiving this
Well,
medication?
you're the cameraman. Now move along.
She tested
gotta show
positive
her,
actually
you're
for
tall.
gram-negative
They gotta see
bacteria.
this thing turning green.
And what action does the medication have on the body?
It inhibits the protein synthesis.
I'm not ready yet, but go ahead.
And when should you question administering this medication?
If the patient was to have intolerance to both bisulfites.
And does the medication have a therapeutic serum level?
It actually does. The trough level should be drawn 30 minutes before the next dose it is to be given. And with that level, it should show less than 2 mcgs per ml in adults.
And which vital sign must be monitored?
With her, I'm going to monitor all vital signs. You're also going to look at the wound appearance on that ulcer, monitor her urine, stools, and her white blood cell count as well.
And which physiological parameter should be monitored when the medication is being administered?
You're going to monitor her renal function, BUN,
Prime the
creatinine,
dial
and
or
blood
clean
levels for
anything when you
toxicity.
connect it to dial flow.
And what
'cause they're both
interventions
sterile.
must be taught to the client to ensure the medication is administered safely in the hospital setting?
I'm going to teach the patient the side effects of the medication, the antibiotic. So with that, I'm going to teach her about ringing in the ears, vertigo, aka dizziness, hearing loss, rash, and as I already said, dizziness.
Okay, and what are the side effects and potential adverse reactions?
Again, ringing in the ears, any type of dizziness, rash, and hearing loss as well.
Okay, and how will you know the medication is effective?
When the patient's white blood cell count is within regular range, and as well as the albumin and other labs are within normal ranges.
Okay, that's all the questions I have right now.
Okay, all right. Well, right now I want to go ahead and I want to look at the MAR to see which medications are actually ordered for the patient. Before we start with that, one thing I like to have handy is the drug guidebook. So if I need to look up anything additional on the medication, any questions I have in the back of my head, it's always best to verify that with the drug guidebook. If I don't get the answers I'm looking for within the book, I'm going to contact the pharmacist, and if all fails, contact the physician. So just be mindful of that. All right, so first here, I'm going to look at the patient's information. So we're dealing with Marta Yarn, 80 years old, no allergies. She is going to be due for, let's see, so the current time is 15:15. Just a second. All right, this thing is touchy girly. So, all right, so she's going to be getting, looks like, the sodium chloride with potassium, starting at 1400. The rate 125 milliliters per hour. It's continuous, and of course the dosage time is going to be 1600, and the route for that is obviously going to be IV. She's also, for her antibiotic, looks like she's going to be getting the gentamicin injection, so that's going to be for the dose. It's going to be IV as well. Let's see, order start 1400. The route IV every 8 hours, 1600, and that's going to be 100 milliliters per hour. So let's go ahead and pull the medicine now. So first with each of these, you want to check out your bags, and you want to make sure there's no leaking, seals aren't broken, and you want to check for clarity as well. So first, as far as the medication goes, you want to check the expiration date. Looks like it doesn't expire until next year, so we're good to go with that. You're going to want to verify the label against the MAR exactly and make sure you have the correct medication. So first we have the sodium chloride 0.9% with potassium chloride. So we have the same reflecting on the MAR, 125 milliliters per hour for the dosage. Frequency is continuous, dosage time 1600, and it's going to be 125 milliliters per hour. So we're good with that. Next, we have the antibiotic, which is the gentamicin. So the same on the label. Again, back to what I said, you want to check out the bag. You want to check out for any break in the bag, breaks in the seal, any leakage, and clarity as well. Expiration date is good, not until next year, so we're good to go with that. Looks like it's going to be getting 80 milligrams in total, so that's going to be 100 milliliters per hour, which is reflected here as well. Route IV piggyback, as I previously mentioned, every 8 hours, and this is also due at 1600. And we're at about 15:18 now, so we're good on time. So now that we got this, her medications, let's go ahead and go in and meet the patient and talk with her. Okay?
Hello.
Hello, how are we doing today? My name's Jackie. I'm going to be your nurse.
I'm doing okay. How are you?
I am blessed. Thank you for asking. How are you feeling?
I'm doing okay.
Doing okay? What's your pain at right now from a scale of 1 to 10?
It's probably about a 1 or 0.
Okay, I just want to double check with that because I know a few hours ago you were at about a 6. So,
They gave me something though, so.
okay, all right. Well, that works too. I actually have a few things to give you as well. I'll go over that in just a sec. I'm going to verify the doctor's orders and everything. But before I do that, can I just have you verify your name, age, and any known allergies?
My name is Marta Yarn, and I am 80 years old, and I have no allergies.
No allergies.
No, ma'am.
All right then. Okay, so it looks like today you're going to be getting the sodium chloride with potassium. Try to get your fluid levels up. So that's going to be your primary IV line, right? And then we also have an antibiotic for you as well. You're going to be getting for that the gentamicin piggyback for about an hour. So after I set your IV lines up, I'm going to be back to switch your flow rate for that.
Okay.
To get back to your primary line.
For this patient,
Okay.
since she
All right.
has
All right. Go ahead and get
end-stage renal
started
disease,
here.
I consulted
That's at a
the
safe level. Okay.
pharmacology manual
So,
on it, and there is.
First, we're going to start out with primary line. So before I even hang the bag, I want to go ahead and type in the medication and do another medication check within the system. So let me just pull this up here. So this is going to be the primary line. So let's start
So that,
here.
and if there were no signs of infection, of course.
And the reason we do this, Tui, is because you don't want to administer any medication that's not approved by the system. So that's how medication errors happen. So what I'm going to do here is input the patient ID and medication number, and I want to get a green light so the system can verify it's the correct medication given.
Them all, but especially in this case, we're going to be interested in what happens to her temperature.
Bear with me real
to
quick.
see if it is having an effect on lowering the fever.
Which physiological parameters should be monitored when the medication is being administered?
We want to watch really all of the vital signs. We're going to be looking for any rapid changes of blood pressure, any rapid changes in temperature, heart rate, respiratory rate, because we want to be looking for any reaction signs.
And what interventions must be taught to the client to ensure that the medication is administered safely in the hospital setting?
So
We
how's
wanna
school
make them
going this
aware of
semester for you guys?
possible side effects
It's
and adverse
going.
reactions. Okay,
It's
so,
going. You sounded
Yes.
super confident with that.
for example,
Well, I will say that it doesn't
in this
really
one,
get
for
better.
anaphylaxis,
You just
if
get
she
used
had
to it.
trouble
So
breathing, if she
be
started
mindful
to
of
get a
that.
rash,
all right, cool. So we have the green light. It's verified in the system. So I don't want to save this just yet, but I do want to document
Well, I
the
don't
site,
think she'd
and I'm
probably
going
be
to
sent
put the
home
time
with
of
a,
administration. The
intravenous
reason for that
medication,
is if I were
but,
to
of course, we'd always want to
hit
do the
save on this,
five
it would
rights,
show in the
right person, right
system
drug,
that
right time,
I
right
administered the
drug.
medication and possibly something could happen in between, and I may not end up administering that same medication.
Again, anaphylaxis
So,
is one.
Just
we'll-
little
we'll
tricks
find
of the
out. I'm not
trade
sure
for you
that
to
she's
look
gonna
at
have
early
this,
or
we'll
later
ask her
on.
if she's
Things to go
ever
by.
had it, and has she ever experienced any adverse reactions to any other antibiotic?
How will you time in just a sec? We're gonna leave this as is and not
We'll see
hit
if,
save just yet.
Her temperature drops.
Wash
her
my hands
urinalysis
again.
comes back on the
I'm gonna
second one,
prepare the
it
line
shows
right
no
now and
infection.
spike the bag and get that ready to hang and prime the line. And then what
you
what we're
ready to
also
go?
gonna do is we're gonna need to flush the IV site, and we're gonna make sure it's clear of any infiltration to ensure that we can get that line up and running without any complications. All right.
Well, hi, Shanae. How are you today? My name is Don. I'm your nurse for
Actually, let me
today.
go
I have
ahead
a nursing student, Nina, with me. Is that okay?
Yeah.
Okay, great. So the doctor's ordered some antibiotic for you. First of all, can I get your name, please?
Shanae,
Okay, and Shanae, what's your date of birth?
30 years old.
Okay, great. And then I'm gonna verify that here. I've got the right person. Shanae, have you ever taken any antibiotics? In this case, I see you have an allergy to trimethorphan. Have you ever had an allergy or allergic reaction to any others?
No.
Okay.
All
I'm
right.
gonna check here just to make sure.
So I'm going to go
nothing else
ahead
besides
and
that.
verify the
Verify that.
patient's name and date of birth again. Marta, can I have you verify your name and date of birth and any allergies, please?
I am Marty Darn. I am
All
80
right,
years
so we're
old and I
gonna
have
go
no
through some
allergies.
80 years young, huh?
today.
That's right.
See what you did there?
So young.
Okay. All right then. So we got the correct patient, right? So let's go ahead and do our last medication check against the system. All right. So we got the sodium chloride, 0.9% with potassium chloride. The dose is 125 milliliters per hour. We have the correct patient on the MAR as well. She's 80 years old and she has no allergies. Expiration date is good to go.
Okay, so we were
And the route
just
obviously
pulling
is
her
going to be
meds out.
IV. ID. All right, cool. So let's go ahead and spike the
We're
bag.
gonna do a little visual inspection.
Oops.
I'm gonna check,
All
make sure
right,
there's no
well-
leaks, it's not cloudy, expiration date's good.
Since we had a jumper there, let's go ahead
I'm
and
also gonna
just
check that it is what is
scrub the hub
prescribed,
on
of course.
this. You can never be
This
too
is,
safe.
Sodium chloride, normal saline.
Okay.
That is correct.
All right.
And, we're gonna check our antibiotic and make sure that Impenium, Celastin,
Let your tubing hit the floor.
that is correct.
Rule of
I've
thumb.
got the right dose.
All
500
right.
milligrams and 100 ml.
Usually want to bring this down. You'll see the fluid going at about halfway.
It is the correct time to administer. Okay, and it is
My bag.
again, this is of course IV.
Marta, you
Prior
still
to,
doing okay?
I'm doing
pulling
great.
these, I checked with
Alright.
the pharmacist to make sure I didn't have to add anything.
So
mix
before you
anything with
actually
these two
attach
drugs.
the line, you'll notice here I have a dial flow
Okay, so
connected,
verify the drugs,
and
right,
this allows you to control your flow rate of the IV. So right now you want to have that to open because we want to go ahead and prime the dial flow as well. So go ahead and unclamp. Get this ready before I do the flush on the patient.
Makes sense. Now, unfortunately, they needed all of the pumps up in the ICU.
And you
so
want
we
to
have
get
do
rid
this
of any
the
air
old-fashioned
bubbles or
way with
anything
a
on the
manual
line, and this thing is flowing like a beast.
What's it
So
called? A dial-up?
we're good with this.
And, it's not especially
Alright.
the old-fashioned
Go ahead
way,
and hang
but
this up here.
it is a way to monitor the,
It's ready to go. Alright. Next I'm gonna do the IV flush real quick. So alright,
Actually,
Marta.
would you mind reaching behind you and grabbing a dial flow out of the cart?
Sure. Okay. I'm gonna scrub the hub on this.
Okay, so.
In contact with the bed and everything, so you want to make sure
that my
everything's
clamp is all the
sanitary.
way down. Close it off. I'm gonna keep control of both ends of my tubing.
Okay. Looks good with that. Still doing okay?
I'm doing good.
All right. So we're gonna go ahead and
Cap off my saline.
oh hey, set this to 125
Take the cap off of there.
for your dial flow. And I did just sanitize this, but I did put it back down. So I'm gonna go ahead and give this another swipe, 15 seconds, just to play it safe.
Coming down.
All right.
Try to get all the air out of
Connect.
this.
Okay.
Do that a little
Shoot
more.
the ground. Triple checking my work. We're at 125 for the flow rate. So let's go ahead and get this bad boy running.
Okay, so now that we've got that primed, we have to verify and make sure that we've got
It's
the
all
right patient.
entangled. Make sure everything's running smooth. You're gonna open this
Again, I'm
up.
gonna check normal saline, 30 ml per minute.
Alright. Kind
And
of like drops here. 1, 2, 3, 4, 5. You want to hang out and make sure this is running properly. I like to just go along the lines, make sure no leaks, no air bubbles, and no infiltration over here. Nothing's leaking, so that is good to go. So I'm gonna go ahead and save this. So just a minute, right? All right. So time is 15:29. And so this is good. Okay. Next, we're going to be doing the actual antibiotic. So, keyboard's going to be so nasty. Alright, so we have the antibiotic. You're going to verify, you can do your third med check real quick. So you have the gentamicin, same as the label, 80 milligrams at 100 milliliters per hour. Again, this is going to be IV piggyback, so it's going to run for an hour at a different flow rate. And it looks like it's due at 1600 as well, and the time is 15:30, so we're good with that. And again, no holes in the bag, and
Sorry
clearly
about
looks
that.
good, and expiration date is good.
Alright, so
So,
now we're going.
with this, same as the primary line, we're going to go ahead and
This happens sometimes.
okay.
So,
Let's put in the patient ID real quick.
we've got our sodium chloride, 30 ml per hour. I just need to check and make sure we've got the right patient again.
Okay. And medication. Late night last night?
Yep.
Oh,
Kind of sleepy.
yeah. It comes in spurts, I feel like.
Get it, scratches. This is too much trouble. Just click on the green dot, right?
It's slow, it's loading. I'm checking it out. See how there's still the hand outside
Yeah.
here? It's stuck. It's just slow. But that's not
You know what? Let's let her go.
So you have to restart it.
Yeah.
Universal.
I think it's very slow. You have to wait. Very slow.
Okay, there's the sodium chloride or the
Secondary.
secondary.
Alright, so we again have the patient verified in the system, and the second medication is good to deliver. So, we're not going to say that again until we until after we administer the medication. These are something else. Like, I feel like I have T-Rex arms. Like,
Yes, because this one I got to do really well.
are you still good over there?
I'm too impressive in here with those gloves.
Man, this thing is slow.
It's really
Those
slow.
gloves are the worst though.
Yes.
Stuck there.
Yeah, it's trying.
But it's all for you, so we are make it work.
That's right, it's all for me.
I don't know my own strength, Marta. I gotta work on this. Goodness.
Just don't break me.
I won't.
You got it.
Alright, girl. I got you. Alright, so we are gonna go ahead and spike this bag.
Check with Don.
Top's good, so we're gonna go ahead and pull this off. Sanitary. Okay. Good. Halfway.
Did you have the secondary?
This bag, and this is medication. You could do two things. You could do a backflow. You could do some somersaults and some tricks. I like to just get straight to the point, so I waste as least amount of medication as possible.
If you had normal
We're good. There are no bubbles in the line. So you're going to want to make sure that your piggyback's higher than your primary. So, scrub the hub over here. This. Okay.
Sorry about that. I get off a little bit, but I'm not screaming.
Before you even think of, yeah, I feel like that was stuck there a little bit. You want to go ahead, let me triple check. Let's see. Okay, resetting this. So we're going from 125 to the 100 for the flow rate. And Marta, I'm resetting your flow rate for your antibiotic. I am going to be back in an hour to change it to your original Flow-Rate for your primary infusion, okay?
Okay.
All right. So everything's open and flowing here.
Pardon?
1, 2,
Oh, you want?
3, 4, and 5.
She's
All right, so she's good, and I want to again triple check her IV site. No infiltration. I see no leakage, and her skin looks good. No irritation there. Flow rate's good. Set at 100. You want to go ahead and label your tubing after you administer your medication, name, date, and time on this. Both of these actually. All right, Marta. So, we gave you an antibiotic today, and as I mentioned before, the symptoms for that are going to be dizziness, hearing loss, rash, ringing in your ears. And if you start experiencing any of those symptoms, I need you to buzz your call light and come in here so we can assess you, so we can make sure you're not having complications to the medication. So with that said, do you mind repeating back to me some of those signs and symptoms?
Ringing in my ears, dizziness, rash, hearing loss.
Hearing loss, okay. That's very good. I also printed off some learning material for you as well. I found online about the medication and the signs and symptoms of negative side effects of medication.
Perfect.
So if you want to read this in between your shows. Let me lower your bed here. Feel okay for you? And your
Yeah.
call light is right here if you need anything. Go ahead and buzz that bad boy and I will come in and we'll chat.
Awesome. Thank you so much.
Okay, do you have any questions?
No, I think you covered it.
Okay, how's that pain level doing?
I'm still good.
You still good?
Yeah.
What number would you say you're at?
I'm probably about a 1.
Okay, alright. I'm gonna just finish documenting minister time there. So we got 15:38. Alright, so everything is good here. Finish my other documentation later for charting.
Is it okay if I ask you more questions?
You certainly can.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I wanted to check the vital signs. I also wanted to check the white blood cell count, as well as the albumin levels and other labs.
And did this information affect your decision to administer the medication?
Yes, if, let's see here. If any of the vitals were extremely out of range or out of whack, that would have made me question the medication, as well as the white blood cell count, albumin levels, out of range as well.
So did this information affect how you administer the medication?
I'm sorry?
Did this information affect how you administer the medication?
It didn't affect how I did, but like I said, if any of those levels were out of range, I would have withheld the medication and contacted her physician and ensured that I could administer the medication safely if I needed to hold off.
Okay, I'm good.
All right?
Yeah.
You good to go?
Yes.
All right, let's go out to the hallway. I just need to finish some other documentation and we can see some more patients.